Hi, it's March 31st. It was just a week ago that we had the Thrilla in D.C., where the Republican partisans tried to hammer out an agreement for the American Health Care Act and failed. At the end of the day, the gunslingers retreated to their offices without firing a shot and weren't able to make good on their promise of repealing Obamacare. So the week started quite naturally with finger pointing and wound licking, perfectly natural. Interestingly, though, there appeared to be some distance opening up between Speaker Ryan and President Trump. Speaker Ryan suggested quite forcefully that the only way forward on health care was with a conservative Republican alternative. President Trump, on the other hand, signaled his potential openness to a bipartisan solution. We'll see how that unfolds. Midweek, we published an article, Trumpian Healthcare Reform, a Silver Linings Legislative Playbook, a little bit of a play on the movie The Silver Linings Playbook. And in that, we suggest that a bipartisan task force is the way to go forward. And the logic underlying that is this would give us a chance as a country to address two deeply embedded ironies in the current healthcare debate. The first irony is that Trump supporters, by and large, are sicker and in greater need of healthcare services than the population as a whole. So greater access is ultimately directly beneficial disproportionately to Trump supporters. The second irony is that Obamacare is largely at its core Republican legislation. Let's deal with them individually. We have a partnership with Carrot Health, a big data company, and a couple of weeks ago they showed me a heat map of their inactivity index. The inactivity index measures the extent to which adults move. And there is very high correlation, as you might expect, between a high inactivity index and chronic disease, high healthcare spending, and so on. Well, that heat map that they showed me looked identical to a Trump electoral map. So I asked the folks at Carrot to produce a heat map that compared their inactivity model to the Trump electoral victory. And honest to God, they look identical to one another. And it's here up on the screen right now. And what that tells us is that counties that voted 70% or more for Trump disproportionately have higher inactivity, higher healthcare spending, higher levels of chronic disease, many more unnecessary procedures, and so on. So, second irony is Obamacare is essentially Republican legislation. The core principles embedded in Obamacare, public exchanges, mandates, and risk corridors, all originated in Republican think tanks and had their first expression in Massachusetts under and then Governor Romney Care. So honestly, if we can take the emotion out of the healthcare debate, moderate Republicans and Democrats are going to agree on about 80% of what we need to do to go forward. That's enough to have a deal. So my recommendation to President Trump, if he were to listen, is appoint a bipartisan task force. Pick a couple of real heavyweights, one Republican, one Democrat, to lead it. My recommendation there would be Mitt Romney on the Republican side, Tom Daschle on the Democratic side. Let them work with your administration and Congress to hammer out an agreement that Congress can support. You get it off your desk. If it works, you get to declare victory, cut a ribbon, and actually accomplish a great thing for the American people. So that's my recommendation there. The other big announcement this week was that the Congressional Budget Office came out with their annual forecast of 30-year expenditure patterns. And not surprisingly, if we continue on the current path, healthcare spending goes from about 0.25% of the budget, or a quarter of the budget, to just under a third of the budget. Massive, ever upward spiraling healthcare costs. And we just know that that can't continue. So something's going to happen. Something's got to give. Let's hope that a bipartisan task force is the way to break the logjam and move forward in a progressive manner. So today's March 31st. That means tomorrow is April Fool's Day. Maybe we'll wake up tomorrow and we'll discover that this has all been just a bad dream and we actually have great health care with terrific outcomes, low costs, and great customer service in America. Of course, that's not true, but we can always hope. And we actually should get should get going on that, and a bipartisan task force is the way to go. So have a great weekend. We'll see you next week.